So welcome to tonight's discussion with Dr. Peggy Hamburg, the former commissioner of the U.S. Food and Drug Administration, or the FDA, and the former foreign secretary of the National Academy of Medicine. She's going to discuss leadership in public health and women's health and her journey as a woman scientist, including maintaining work-life balance. I'm Dorothy Teagarden, the director of the Women's Global Health Institute. The Institute serves as a nexus of interdisciplinary research to create partnerships, promote research, and develop training opportunities to improve the health of women globally, with a focus on research on prevention and early detection. So thank you all for joining us tonight. We're really excited about the number of registrants we have for tonight's interview and are really looking forward to this exchange. We're also excited to welcome and thank the co-sponsors for this event: the Purdue Institute of Inflammation, Immunology, and Infectious Disease, the College of Health and Human Sciences, the Purdue Policy Research Institute, the Women in Science Program, and the Susan Bulkley Butler Center for Leadership Excellence. If you have questions for Dr. Hamburg, please enter them in the Q&A box at any time, and we'll cover as many as possible at the end of the interview. I'm really pleased to introduce the interviewer for tonight's discussion, Dr. Laura Murray-Kolb. Dr. Murray-Kolb is the department head of nutrition science in the College of Health and Human Sciences at Purdue. Murray-Kolb holds a master's and a doctorate in nutrition from the Penn State University. She's a really accomplished scientist, well-funded and published, with research that focuses on understanding the neurophysiological and the neuropsychological consequences of iron deficiency, with the aim of informing the development of policies designed to improve maternal and child health worldwide. Thank you, Dr. Murray-Kolb, for agreeing to serve as the interviewer for tonight's event. We really appreciate your time. I'm also very pleased to introduce Dr. Jerome Adams, Purdue Presidential Fellow, the Executive Director of Purdue's Health Equity Initiatives, and Distinguished Professor of Practice in the departments of both pharmacy practice and public health at Purdue. Dr. Adams also served as the 20th Surgeon General of the United States. Dr. Adams?
Well, hello, everyone. I am so very glad to be here to introduce tonight's speaker for the Women's Global Health Institute Interview Series, Dr. Margaret Peggy Hamburg. This interview series celebrates the success of distinguished women scientists and leaders. And the truth is, we don't get much more distinguished than Dr. Hamburg. The goal is to highlight career contributions to science, share what these interviewees have learned and experienced along their career paths, and discern any advice that they may have for others in science, particularly for women who are interested in pursuing careers in science. We're pleased to have Dr. Margaret Hamburg as our distinguished guest for this interview. And just very quickly, I want you to know she earned her bachelor's degree at Harvard College and received her MD at Harvard Medical School, coming from a long line of physicians in her family. And perhaps she'll tell you a little bit about that and how it impacted her decision-making. Early in her career, Dr. Hamburg was a neuroscience researcher at the Rockefeller University and at the National Institutes of Health. She's widely published and has received numerous awards and honorary degrees, too many to mention. She's also served in numerous prestigious positions in public health, being the former commissioner of the U.S. Food and Drug Administration and former secretary of the National Academy of Medicine. She's an internationally recognized leader in public health, medicine, and biomedical research and innovation. And in her leadership role at the FDA, she was known for advancing regulatory science, modernizing regulatory pathways, globalizing the agency, and implementing public health policies on disease prevention. And since you said to submit your questions, I'm going to submit mine early on for Dr. Hamburg and Dr. Murray-Kolb. I recently wrote an op-ed along with Senator Bill Frist saying we need to put the F back in FDA. So if you get a chance, I'd love for you all to talk a little bit about the FDA's regulatory authorities and how we can use federal policymaking to improve nutrition and health in our country. Dr. Hamburg's many other prominent roles include serving as president and chair of the American Association for the Advancement of Science, assistant secretary for planning and evaluation for the Department of Health and Human Services, assistant director of the National Institute of Allergy and Infectious Disease, the institute that Dr. Fauci currently leads, and commissioner of the New York City Department of Health and Mental Hygiene, where she worked to improve services for women and children. She's considered an expert on biological threats, public health preparedness and emergency response, and many other areas that are at the forefront of the conversation now, particularly with the pandemic. Dr. Hamburg currently is Interim Vice President for Biological Programs and Policy and a board member at the Nuclear Threat Initiative. So we are just so very pleased to have her here with us today and to get her to share some of her story. Without further ado, I give you Dr. Peggy Hamburg and Dr. Murray-Kolb.
Thank you.
Thank you. Thank you so much. And what an honor it is for me to have the opportunity, Dr. Hamburg, to ask you a few questions this evening. I know we're all really looking forward to learning from your many and varied experiences as a scientist. And so, since I know that time is short, I thought I'd go ahead and jump right in and start by asking you first, if you could please tell us about your career path and how a clinician like you found yourself working at the FDA.
Well, my career path was certainly not thought out ahead of time. I would never have predicted that I would have had several of the jobs that I ended up having. And in fact, I would have bet large sums of money that even if offered, I would never have taken the FDA job. But, really what happened for me, I actually grew up the child of two academic physicians on the Stanford campus where they did research and taught and took care of patients. And I thought I too would be an academic physician and that my career would focus on teaching, research, and patient care. I was very interested in endocrinology. I thought I would either do neuroendocrinology or reproductive endocrinology. And I thought so when I went off to medical school. But during the course of medical school, I watched this strange, unexpected disease emerge that at the time, nobody knew what to call it. Nobody knew what caused it, but people in the prime of life were developing this immune compromise, and it was a fatal disease. It was affecting, very specific populations from what we could tell, but we really didn't understand what was going on. Of course, it was HIV/AIDS, we learned. And when I did my residency training in New York City, I took care of many patients with AIDS, but we still had nothing to offer them medically. And I could also see that it was raising all kinds of critical issues at the intersection of science and medicine with society, with economics, with politics. And I really only then began to think about public health and working at this interface of different disciplines and really trying to look at the relationship between science and medicine and public health in important ways. I then went down to Washington, D.C. to learn more because I actually had not been taught about public health in medical school. And I had the great good fortune, actually, thanks to a former Surgeon General Koop, to first work in the Office of the Assistant Secretary for Health and something called the Office of Disease Prevention and Health Promotion as a special assistant to the director of that office. And then partly because of my very strong interest in HIV/AIDS, I had the opportunity actually to go over to the National Institute of Allergy and Infectious Diseases to join Tony Fauci as his special assistant and then as assistant director of the Institute. That was transformational. And in those early days working with Tony Fauci, I think I really learned more about the importance of really harnessing science to benefit people as efficiently and effectively as possible. I had the opportunity to work with the FDA as well as many other communities, including the HIV/AIDS activists, to sort of rethink some of our approaches to how we did clinical research and how we engaged patients and really brought in patient concerns. And so even though I didn't realize it then, I was sort of being imprinted in a way that made me, very open and receptive to many of the issues that I had to grapple with when I got to the FDA, with a few steps in between, including New York City Health Commissioner. And I should say, I was recruited to be Health Commissioner in New York City by a former commissioner of the state of Indiana, Dr. Woodrow Myers.
Wow, that's great. And I think, one of the messages I was hearing is that our career path is not always what we expect it to be, but that you really took advantage of some opportunities that were presented.
Well, that's absolutely right. And, and it was not without its challenges. I was not following the path that I had trained for, and I wasn't altogether encouraged on this path when I decided to go down to Washington to learn about health policy and public health and work in government. My chair of medicine said to me, if you're not back in 2 years to do your subspecialty training, you will have thrown away your whole medical career. The great irony there was I wasn't back in 2 years to do subspecialty training, but about a decade later, he called me and he said, I'd really like your advice on how I could transition into health policy. So, but, I think it is so important to sort of listen to where your passion is, listen to what, really moves you intellectually and personally. And, one of the things I really had to learn, and I had to be pushed a little bit, is that when a door opens for a wonderful opportunity, even if challenging, even if daunting, don't be afraid to go through and do the very best you can. And I felt that way when I took the health commissioner job in New York City. I was the youngest person ever to take on that job. I felt I had very minimal real training or experience to lead me to take that job on. But the mayor of New York City had confidence in me, Mayor Dinkins, and I'd been serving as acting for a period. He encouraged me to take it. My husband encouraged me to take it, and I did. And then FDA was sort of a similar story, where initially I had not been at all sure I really wanted it. That's quite a hot seat of a job. But, the opportunity to make a difference in the lives of people, in the United States and well beyond, was extraordinary. And the scope of the FDA, as already was noted by Dr. Adams, is really remarkable. And I learned so much. Every stage of my career, I've had the chance to bring something of my past experience to it, but also learn about new things in new areas and expand, my horizons while, hopefully, being able to contribute.
Yeah. Absolutely. So speaking of your role as Commissioner of FDA, as well as Health Commissioner for New York City, can you say a little bit more about what it's like to be in those leadership positions in public health?
Well, it's very challenging, but it's also very exciting because you feel you're really where the action is, and you feel that, you really can make a difference. You also do feel very accountable for the decisions you make and how you lead your agency. I do think, I have to be honest, that being a public health leader is harder now than ever before. I think it's partly that public health and politics have become very intertwined and very highly charged. It's not like politics weren't always part of doing public health. But I think that, to be blunt, the environment is much more toxic and much more partisan. And I do think that social media makes it much harder in 24-hour news cycles to be in these roles. So that saddens me. And I hope that we will be able to really work on that and help restore the trust and confidence in public health agencies and the importance of public health as we think about what matters to people, their health and productivity, our economy and our economic prosperity, and of course, our safety and security. So there's a lot of work to be done in the realm of public health, but public health leadership has always, I think, really required an ability to work across various domains of expertise, to be able to work at different levels of government, as well as working, with a whole range of stakeholders from, communities, with the FDA, of course, industry, and to be able to really apply knowledge and data and evidence to hard problems.
Yeah, and speaking of working across disciplines, I know when you and I spoke earlier that you mentioned the importance of that to you, one of those important themes, being able to work across disciplines and sectors, and just thinking about potentially having quite a few students in our audience tonight. I was wondering if you had, a message to them about the importance of getting that cross-disciplinary training.
Yeah, well, I think it's so essential. I think cross-disciplinary training, and also the concept of really working in collaborative ways. When I was coming up through medicine, there was much more stovepiping of disciplines, and also much more emphasis on your sort of individual accomplishment. But especially if you want to be able to sort of harness the power of science and technology and advances in those fields for the benefit of society. The big problems we face don't align with one specific discipline or another. And so if we're going to find meaningful and enduring solutions to the important problems before us, whether it's dealing with a global pandemic like COVID-19, or addressing the huge challenges of chronic disease, the issues around climate change and health, which are huge, and climate change more broadly, the issues around disparities in health, and so many other things, we have to be able to transcend disciplines and other boundaries that we've somehow often imposed on ourselves, but actually hinder our ability to work most effectively and find the best solutions.
Yes, absolutely. I think, some of our most pressing questions these days really require, interdisciplinary, multidisciplinary teams, collaboration. And it's great to hear that. We're definitely, we think that interprofessional education is really important at Purdue. And so training our students to be able to communicate with students from other disciplines is something that is important to us. So thinking about not only COVID-19, but other diseases, we know that women display different symptoms to diseases, and they respond differently to treatments compared to men. And so one question is, how does gender affect the FDA's regulations on drugs, devices, and treatments?
Yes, well, this has been an area of focus for some time, because when you look at biomedical product development and the clinical studies, and even the preclinical studies that go into generating the database for assessing whether these products are safe and effective and should go into broader use, very often women are not adequately represented in the clinical trials, even when they make up a significant component of the actual population burdened by disease. Sometimes it's because, to be honest, in the past especially, but still it goes on, that it's underestimated the burden of disease. When I was growing up as a doctor, the people really did think that heart disease was more predominant in men. But of course, that wasn't true. We just hadn't adequately studied it, and women were sadly being underdiagnosed. So, that sometimes study populations reflect, failure to fully understand the nature of the disease and who is experiencing it, but also women of reproductive age often are not included in studies. And that's been partly a reflection of concerns that you wouldn't want to inadvertently expose a woman and her developing fetus to a drug that might have toxicities. But that the other side of that, of course, is that then a population that may really need access to a given product don't know whether or not it works for them, and don't understand, the risks and benefits. So I think there's been a real effort to look at the composition of clinical trials and make sure that it's reflecting the actual real world burden of disease. And that's true not just for women, but also other minority populations as well. But it has moved more slowly than one would hope. And it's an area that we need to continue to work on, and academic institutions play a big role in helping to ensure that the recruitment efforts and the educational efforts around clinical research that's going on are adequate to help reach out to the different populations that should be participating, to provide, clear information and understanding about the clinical trials and what it means to be involved, and provide the necessary support to enable this, fuller enrollment in clinical research.
Yes, as you were talking, I was thinking, as researchers, we really have the opportunity to make a difference here, and to push things forward by making sure that we're being very purposeful in who we're including in our research. So that's a great reminder.
Absolutely. And, another point that's related, when I was at FDA, we really started to focus on sort of patient-centered product development. And that's very important also, and something I learned back when I was working in the early days of HIV/AIDS, to really understand the experience of a disease from the patient perspective is very important, to know what symptoms really matter in terms of what a product should be addressing, issues around delivery of a product and how it's used that will make it more or less likely to really be complied with by people that have to take it in the real world. And I think that this is an area that, again, we have to continue to really work on, so that we're not just thinking about how to do something that's scientifically rigorous, but something that's scientifically rigorous but also addresses critical unmet public health and medical care needs.
Yeah, that's a great reminder too. So here's a not so easy question for you. So what do you think are the most challenging issues in public health and women's health, both in the United States and globally at this point in time?
Well, there are a set of critical issues and concerns, obviously, and they can fit into some broad categories. I mean, I think as we are still struggling with COVID-19, we need to keep a very focused eye on the seriousness of infectious disease threats, the fact that you need public health and medical care systems working together. You need to be able to provide public health leadership that's listened to by political leaders. And you have to have, strong, robust systems in terms of public health and healthcare to be able to achieve these goals. And you need to advance science to address emerging needs and to ensure that existing needs are adequately addressed. While we are very focused on infectious disease threats at the moment because we're all living and, dare I say, breathing COVID-19, SARS coronavirus 2. Chronic diseases represent a huge burden of disease in this country and around the world. Many of those diseases are preventable through certain kinds of behaviors and activities, more emphasis on nutrition, exercise, and of course, smoking prevention and issues around drug use and abuse as well. Those are taking terrible tolls on our population, and we need to continue to address those and their problems, not just in this country and around the world. I think we do have to put a special focus on women's health because, especially from the perspective of women as the sort of hub of so much else, we need to care about women and their health and address it, directly. And I think often women's health issues have been marginalized a bit, as I was talking about with respect to clinical research and biomedical product development, but in other ways as well. Women also, we have to recognize, because of their critical roles historically and today as caregivers and effectively running their families, and also increasingly having demanding roles in the workplace, the challenges of making sure that there's access to medical care and access to medical care in ways that can fit with these other responsibilities and demands on time. And then at the end of the day also, and this is particularly true in the context of developing economies, but it's true everywhere, that strong, healthy women make a huge difference in terms of the health of families, communities, and the health of economies. So, women are a linchpin in terms of ensuring both education and health, and we need to address it for all kinds of reasons. And I think, sadly, at the moment, we are in a period where women's health is in some jeopardy in some critical areas. We need to make sure that with everything else swirling around, that we do not, forget the importance of working on some of the issues we've already talked about. And also, I feel very strongly ensuring that women have the reproductive health opportunities that they need as well.
It strikes me when you started the answer, you mentioned several things that I'll sort of label as infrastructure that are needed to be in place, to be able to tackle some of these challenging public health issues. And as I was listening to your answer, I was thinking, more globally, especially in low and middle income countries, how there's such a lack of infrastructure, in so many areas. And just wondering if you could maybe speak a little bit more to that in terms of, again, women's health and public health in those settings.
Yeah, well, I think we really do have to emerge from the experience with COVID-19 and other issues that are ongoing to recognize that we don't have adequate systems of care. We do not have robust infrastructures in this country or in middle income and low income countries, that if we can't think of health as an afterthought or something that you address after you've worked on development issues, but that health actually drives the ability to advance economies and to really achieve a set of other issues that people sometimes give more priority to, but it actually is the fundamental issue of health, well-being, and productivity that makes the difference. And, studies have shown that investing in women's health and education, I would add, actually is, one of the most important and effective investments in terms of development and economic assistance.
Yes. So this next question we've touched on with some of your other answers, but it starts by asking, specifically in terms of COVID-19, we know again that women have been disproportionately affected. What do you think we can do better in women's health so that we will be prepared for future pandemics and public health crises? And again, I think you've already touched on this with some of your answer.
Well, I think we have to be realistic about sort of who's on the front lines of exposure and who's on the front lines of providing care, and women are often both. Women with COVID-19 were, I think, disproportionately exposed because of the nature of many of their jobs, and were essential workers in many ways. They also were in positions where they were giving care to others who were infected and sick, putting themselves at risk. And this is also true of people of color. I think that they were disproportionately impacted, and certainly issues around access to care, and whether you have other illnesses or conditions that may make you more vulnerable as well. But we have a serious problem in this country. We have a serious problem when you look at global health, that we've got fragmented systems of care. We don't have care that's organized for people to access it outside of limited hours, often challenging transportation needs. And of course, for many, financial access to care is critical as well. And I think we have to give all of these issues higher priority because, as we've seen with COVID, and as I was just saying, it is health, in fact, that drives so many other things that we all care about. And we can't let it be, a second tier concern. We have to put it at the center, and health in all policies really matters. I mean, it's very interesting when you think about the things that influence health, and this is sort of going to the core of public health. So much of what's important for health doesn't happen in a clinical care setting. It happens in the community and in the household. And we have to recognize that, and we have to build that in to how we live and our policies. We have to understand the social determinants of health and address the critical need for various kinds of social services if we're really going to improve health and prevent disease. And, we have a lot to learn and a lot of work to do. But at the end of the day, as we've seen with COVID, investing in health and preventing disease is a lot more cost effective than trying to deal with it afterwards, whether it's treating a disease that requires hospitalization and intensive medical care versus preventing it in the first place, or dealing with a global pandemic when strong public health systems and the application of strong science and science-driven policies could actually have helped to control and limit spread.
Yeah, so it sounds like we really need to work, especially on the fragmented systems of care that we have right now in order to be ready for the next pandemic or public health crisis.
Absolutely.
So with all the work and responsibilities that you have, one of the overarching questions is always, how do you maintain a balance between work and family?
Well, it isn't easy. And I think, that one of the things, for better or for worse, that I sort of came to realize was that, you didn't always have to do everything perfectly, but you had to do, your best. And you don't always have to do everything yourself. I actually think that my leadership benefited from the fact that I didn't feel that I always had to be the spokesperson. I didn't always have to be in charge, that I had the great good fortune at the FDA and at the New York City Department of Health to work with a group of professionals who had expertise in different domains of activity. And we were a team. And when you work as a team, I think it helps you to be able to also balance. And it was funny, when I was at the FDA, I think it was really, really important that I set a model for others that it was okay to go home at a decent hour in order to have dinner with your family. It wasn't like, I have to say, work stopped thereafter, but the importance of really consciously trying to find balance, I think sometimes gets forgotten. In fact, just a little aside, my first week as FDA commissioner, while I was still, trying to find my way to the bathroom, there were a number of people on my sort of executive leadership team who were, all in the sort of area of the commissioner's office hanging out. And it was a little bit after 7. And I decided I really wanted to go home. My kids were young then, and I, wanted to spend time with them. And I was walking out, and I said to some of these other people, I guess I'm going home, before the rest of you, but you ought to go home. Don't you have young kids, et cetera? And one of them said to me seriously, well, you don't have to say you're going home. You could say you're going to an event. And I said, no, I'm going to say I'm going home because it's really important to go home and, be part of your family and a presence in your children's lives. And you should go home too. So, I think that really being conscious about decisions makes a difference. I had the great good fortune also of having a mother who was a professional, who I used to tease her when I got older and had kids that she made it look too easy. But she, she showed me some of the strategies for achieving work-life balance as well.
Would you say it's something that we have to work on our whole lives? I think sometimes I think some of the students that I work with get the impression that, well, at a certain point, you just kind of have it, and you don't have that struggle anymore. So I'd love to hear your thoughts on that.
No, I think that's absolutely right. And I think, when you're talking about being a mother, also, there are different times in your children's lives when you want to be more available. You want to be the one, that talks to them about certain issues. It's, if you're in the position that, I, fortunately was that, we could have, someone to help in the house, but, I wanted to do many things with my kids, and they wanted to do them with me. Again, just to indulge in a story, at one point, after 9/11, and the anthrax letters, I was very, very much involved in thinking about preparedness and response issues. I had developed, sort of to my surprise, an expertise in bioterror threats when I was New York City Health Commissioner, because I was working there the first time the World Trade Center was bombed. People forget that there was an earlier episode, but for me, it was a very powerful event that made me think in totally new ways about the threat of domestic terrorism, and what, as health commissioner in New York City, the sort of physician for the city, what were the possible threats I needed to be preparing for, and what were the sort of systems for response that needed to be developed and practiced so that in a crisis we could respond. So then I went on to the federal government, and then after 9/11, I was working on biological threat issues, naturally occurring and potential bioterror and bioweapons issues at this organization called the Nuclear Threat Initiative. But anyway, I was very involved in the response to those issues, and everywhere I went, people would ask me about anthrax and about the threat of bioterrorism and whether they should be putting plastic wrap and duct tape up on their windows and all kinds of things. And at one point, my daughter said to me, "Why can't I have a normal mother who drives carpool and doesn't talk about anthrax all the time?" And suddenly I realized that maybe I'd like to drive carpool occasionally. And at that point, I decided actually to soon thereafter, when things had calmed down a bit, to pull back from my job and work part-time as chief scientist there, but not running this whole program, and and drive carpool and do a few other things. So the great revelation for me with that was that I did worry, am I now off the career track? And to my astonishment, the answer was no. I got the call asking me to be the FDA commissioner. And the next chapter began. So you can work in cycles as well, I think.
Yes, I think that idea of cycles is really important, to remember that there are phases to life. And as you mentioned, we want to do different things with our children, depending on their ages at different times. They require different things from us. So, frankly, jobs require different things and different levels of intensity at different times. And you know more about this than I do, but I think that the academic world, has some real changes to make, and I hope that they are being made. But there is a kind of a disconnect between what the academic sort of infrastructure requires of people and the timing of those, very big investments of time and focus with, when other things may be happening in your personal life if you've chosen to have kids and a family. So, we need to figure out ways to better facilitate this kind of work-life balance, and not penalize people for making certain choices in their life. And I know for me, one of the things that really helped with that was just having great mentors. Mm-hmm. And I think, you mentioned just your own example, right, of leaving and saying, I'm going home. And you just, that can be so impactful, for others.
Yeah. You talk about mentors, and I have to say, during medical school, I suffered from not having enough mentors and role models in the sort of academic world that I was working in. The saving grace for me was that I had a mother who was a professional and very accomplished and a pioneer in many ways. She actually was quite a remarkable woman. She was the first African-American woman to be admitted knowingly to Vassar College. They'd had someone before who was passing, but my mother, was recruited as the first African-American. And then she was the first African-American woman to go to Yale Medical School. So she was a pioneer in those ways. Her medical school class, I think there were 2 of them in the class that were women. And she said that, being female had just as many challenges as being African-American. But, she certainly, demonstrated to me the importance of, sort of following your passion and and being willing to break some barriers. And then professionally, she also, was a pioneer in terms of her area of focus, which was really sort of helping to develop the area of early adolescence. She was a child psychiatrist and a pediatrician by training, as a distinct period in development that had very special needs and risks. So it was, I felt that sort of watching her and hearing about her career path and the choices she made and the experience she had, really helped me a lot. And not everyone has a mother like I did,
Right.
But many people can find mentors. And now that I'm getting to be quite senior along my career path, I feel like one of the most productive things I can do, one of the most meaningful things I can do, is actually to be a mentor to people, coming up the career ladder. And it gives me great gratification.
That's wonderful. It sounds like you had an amazing, strong, mentor in your mom, an example. And as someone with a young adolescent, I can say your mom was right. That is a distinct phase and period of time. So that's absolutely true. Well, I'm just looking at the clock here. I know that we have questions that the audience has for us, but I want to thank you for your time in answering my questions, and maybe turn it over now to Dr. Teagarden to talk about some of the questions from the audience.
Great.
So thank you very much, Dr. Hamburg and Dr. Murray-Kolb. This was really a very engaging conversation and very educational, and sharing your insights about leadership in public health and women's health is really important, as well as how to navigate a successful career as a female scientist and leader. I have so many questions, but right now we're open for questions from the audience, and you can type your questions in for either Dr. Hamburg or Dr. Murray-Kolb into the Q&A box, and make sure it's sent to all panelists, and I'll be reading them out loud. But we do have some questions already, and so we'll try to get to as many as we can in the few minutes we have left. So I have a question here from actually Dr. Mattis. In my mind, the public health community were among the heroes of the response to the COVID pandemic. But as you noted, we are often criticized and considered more a part of the problem. What concrete steps can be taken to reverse this view of the public health system?
Well, it's the great issue of the day, and I think it can be done. I think it will be done. I think, that all of us that work in public health recognize that we can't take trust and confidence for granted, but you really have to earn it every day. And so I think, part of it is just sort of keeping your nose to the grindstone and doing the work. But one of the things that's so crucial, something I would have to say that Dr. Adams, was really terrific at, is communication. We cannot act as though we know better and, we are the experts. So just listen to us. And it doesn't matter if you don't understand. It doesn't matter if you have disagreements or concerns, really just take our advice. I think the ability to speak clearly about what needs to be done and why, and the ability to listen about what people's concerns are and then address them head on is absolutely crucial to building trust and holding on to that trust. And I think one of the things that is hard to do, especially in a crisis, but as a public health leader, is to acknowledge what you don't know in addition to what you know. And I think one of the sort of additional challenges is that I don't think that a lot of people really understand the nature of science, and that science is iterative, and that you don't have absolute answers, especially at any given time in a new and unfolding disease threat like COVID-19. And so I think, it is really important in these kind of situations to be able to say, this is the nature of the problem we're dealing with. This is what we know. This is what we don't know, but we're going to take these steps to better understand and fill in those gaps in our knowledge so that we, can have the best programs and policies to make a difference. Right now we're asking you to do this, and this is why, and why it will matter to you. But, we are going to keep talking to you as we learn more so that we, really make sure that we're doing what makes a difference. And I think, there were a lot of confusions about masks, about how the virus was transmitted, and of course, about the vaccines. And so I think, an important lesson learned here is the importance of communication and listening, and recognizing also that in different settings, different people should be the messenger. And it's not always, the public health official at the, federal government level. It's often, a community leader of some kind that needs to be part of the messaging as well.
Yeah, we've struggled so much with our messaging, health messaging, and in part because it's not black and white. I think you brought up a really good point. It is a iterative process, and that's very hard to communicate. But let me go to the next question. So good evening. Thank you so much for taking the time to speak to us. I saw how some of your background had to do with mental hygiene, and I wanted to ask how you were seeing the effects of COVID on the mental health of Latinx communities.
Well, I think the effects of COVID on mental health broadly has been, just tremendous. It's been recognized, but it's probably underestimated. And, and layer that on top of a healthcare system that doesn't always adequately address mental health needs or even, recognize them. I think that this is a very serious challenge, and one that, we need to be paying attention to. And, people talk about long COVID. Well, I think mental health impacts are going to be a part of that. And I think, you asked about the Latinx community, and I think that certain subpopulations have been disproportionately impacted by COVID-19 on a number of levels. And I think the mental health issues in the Latinx community probably are more pronounced. I have to be honest and say I don't know what the sort of statistics look like, but I think that communities that have felt disenfranchised already, and where some of the restrictions of COVID were very, very hard to implement and sustain, whether it was sort of isolation of individuals exposed to COVID or with COVID, when you don't have a lot of housing options, et cetera, or having to put yourself at risk going into jobs that were essential for our society to continue to function, but on the front lines in terms of risk, adds another level of stress. I think, for kids, those that were more underserved already in terms of educational opportunities and having the tools to then go remote for education. I fear that we've lost, critical time in education, and that brings with it all kinds of mental health issues and stress. And also, of course, the inability that so many kids and adults suffered in terms of the ability to engage with community that matters so much. So there's just a huge amount to be concerned about. In addition, sadly, I think for many, certain risk behaviors like alcohol and drug use escalated during COVID because of anxiety, social isolation, et cetera. So, we have a lot to manage, even as we are guardedly optimistic that maybe the shadow of COVID-19 is beginning to lift some.
So this next question is kind of interesting. Have you worked with any veterinarians in your career? And if so, what do you see as the role of veterinarians in public health?
I have worked with veterinarians, and I recognize the really outstanding veterinary school here at Purdue. Having worked for a very long time on infectious disease threats, I have a deep appreciation for the importance of veterinarian animal health in terms of the health of the animals, but also the health of the human populations that interact with animals. The sort of notion of One Health is critically important. Having been New York City Health Commissioner, one example is that had we paid more attention in New York City to the fact that crows were dying off and that some exotic birds in the Bronx Zoo were getting sick, we might have appreciated this new threat that was emerging in New York City unexpectedly and for the first time in the United States. But there was this disconnect, a lack of sort of sharing information and awareness. And as we look at emerging infectious disease threats of great consequence to human populations, the vast majority over the last couple of decades have been so-called zoonotic diseases, diseases that emerge from animal populations. And as we've come closer to, with all kinds of human activities, unfortunately, we are degrading the environment in which many species live. We're moving humans and their habitats closer to animal populations that used to not interact so closely. And that has, of course, encouraged more of this so-called spillover from animal disease to human disease. And then lastly, I'll just say at the FDA, we actually were responsible for animal food issues and also animal drugs. And so I got more knowledgeable about veterinary health in that context. And again, the importance of thinking about some of these issues as they cross from animal populations and human populations, and the importance of addressing both.
Thank you very much. I'm afraid we're going to have to end, even though we have a couple more interesting questions here. I think we've come to the end of our time. So although I just want to say that I, like you, feel like I'm, advanced in my career, and it's our responsibility to help men and women in their careers to maintain that work-life balance. And your example was a perfect one of how we can help and change the system a little bit to make it easier. So getting off my soapbox, I want to thank you, Dr. Murray-Kolb, and a really special thanks to you, Dr. Hamburg, for this really inspiring discussion. So everybody, please join me in giving both a virtual thank you and applause, even though nobody can really applaud, but it was really wonderful to have you here.
Well, thank you so much. It was a great pleasure to be with you this evening.
It's wonderful. So please visit the Women's Global Health Institute website for the video link to this recording, if you're interested, to the recording of this interview, and to learn more about our upcoming events. And my little pitch here, if you enjoy events like this one tonight and want to keep them going, please consider donating at the WGHI website or clicking on the chat box. Again, I want to thank you so much for joining us, Dr. Adams, Dr. Hamburg, and Dr. Murray-Kolb. It was really wonderful to have you all here. So we hope you all will join us for future events as well. Good night, all. Thank you so much.
Good night.